So, welcome, mothers and others. I am so excited today to introduce you to Representative Donna Howard. I want to say a couple things about Donna first. First of all, Donna Howard is my Texas House Rep. And I'm so excited to introduce her today because she represents the Austin area and she represents us so well. She has been representing District 48 in Austin, Central Texas area since 2006. And honestly, they don't get more Austin than Donna Howard. She was born in Austin. She attended public schools in Austin and went on to graduate from college and graduate school at the University of Texas. She has, even though she's been elected office since 2006, she's also holding on to a couple of really, she's part of a couple of really important committees, the House Appropriations Committee and the State Affairs Committee. And in 2019, Donna was named one of the best legislators of the Texas Monthly. Representative Howard is one of the best advocates that we have for Texas healthcare in the current legislature. And that's why I'm so excited to bring her here tonight so we can ask her some questions about the current status of Texas healthcare, especially for women, especially since the Dobbs ruling last year. So please help me welcome Representative Howard tonight as we discuss the current status of women's health in Texas.
Thank y'all. I really appreciate it.
Yes, we're so glad you're here. So we do have a lot to cover tonight, and it's a new legislative session. And right now, I don't know about you, but in the beginning of a new session, I'm always filled with hope. So walking around the Capitol, I'm trying to be hopeful that we can have good cooperation with, the other side of the aisle and be able to do good things for Texans this year, because really that's why we elect you all in office, right? To do good
Yeah.
things for Texans. It's just maybe some people forgot about it, but let's just go right ahead. We're going to just hit it. We're going to start with some bills that a bill that you have been submitting for consideration for years now. And a funny thing happened last summer. This bill suddenly got the attention of Republicans. After you have been submitting it for years and it not really getting that much attention, all of a sudden Republicans were talking about it and owning it like they did it themselves, which I kind of thought was hilarious. And I'm talking about the tampon tax bill. This is House Bill 70. And so let's just go right ahead and hit it. So do you think this bill, after the last political season, when it got so much attention from Governor Abbott and Comptroller Glenn Hager and Senator Joan Huffman, do you think it's going to get some traction this year?
Wow. Yeah. And, you've set that up very nicely. Being a part of the minority party the entire time that I've been in the legislature since a special election in 2006, the only way I ever get anything done is with bipartisan support. That's just the simple math. And it's not just happened to me, but it's happened to other Democrats when we have had legislation that is good legislation, and then it's recognized by the Republicans to be good legislation. All of a sudden, they take it as their own. And there's nothing we can do about it as the minority party. And if we care about the legislation and its outcome, we're going to still hope that it gets through. So there's several examples I could give you, but the one that you mentioned that's in session right now has to do with the discriminatory sales tax on tampons and other period products. I have had it 3 previous sessions. The first session, we didn't get a hearing. The next session, we got a hearing, but it didn't make it out of committee. Last session, we had a hearing, and with unanimous bipartisan support of the Committee of Ways and Means, they voted it out. It went to calendars, which is the gatekeeper for what gets onto the House floor, and it never got out of calendars for whatever reason. So here we fast forward to this legislative session and the campaign season preceding it. During this interim, I have continued to work on this legislation. We have built all kinds of relationships with stakeholders and advocates and those that are wanting to make sure that we address this issue.
Yeah.
A lot of young people who are part of the period equity movement and who have come to testify, as young as high school girls came to the Capitol and testified on this bill. A lot of college students, they've all been working back in their home communities to raise awareness and to get donations to ensure that people have these supplies. So we got it through, and as I said, it just didn't get a vote get anywhere further on the floor. So then go to this last campaign season when clearly women's health issues were front and center of a lot of what was being talked about. And the Republicans were taking a bit of a beating on their lack of support for women and women's health care, reproductive health care, obviously, in particular, abortion in particular. So with that being said, all of a sudden, they've discovered this legislation that supports women and families and that we have been working on for years. And the comptroller and Senator Joan Huffman, who is the chair of the Senate Finance, very powerful position, both came out saying, oh my gosh, this is archaic. We have got to address this. And yeah, been there, done that. So great. I'm so glad you're finally recognizing it. Let's move forward. But then another quirk about this, what happens oftentimes is the senator gave this bill to a Republican in the House to sponsor. So even though I have the bill, even though I have been the one working on the bill, there is now a Republican in the House, Angie Chin Button, who has been a joint author on my bill. She was a member of Ways and Means. She is now carrying the companion legislation in the House to Senator Huffman's legislation. So obviously, that's the legislation that is going to go forward. But that hasn't stopped me from working on my bill, which I have filed. I'm continuing to work with advocates. It's been just a huge effort this interim. I'm so proud of the work that's been done by my staff and others. We have a group of female lobbyists who realized that this was a very important thing to do, and they have been working with me pro bono to help us raise awareness. They've hosted a variety of events with Capitol staff to raise their awareness and consciousness about this, had diaper drives. Oh, sorry, because I also have the diaper bill. Have diaper drives, had tampon drives, and have contributed these to the local diaper bank, which, even though it's called the diaper bank, also distributes period products. So we've been continuing to work on it, and we will continue to work on it, and I will be thrilled for it to be passed. But that's the nature of what happens in this legislative body to those of us in the minority party. And as I said, it's happened time and time again that bills that we have been pushing and working all of a sudden are discovered and are taken to be their bills. But you know, you got to focus on what's the greater good here. We can point it out as much as we want, but the bottom line is I want this discriminatory sales tax to go away. And I'm going to keep working to make sure it does, no matter who's carrying the bill.
I love that. I love that attitude. That's really great. And for anybody who's watching us right now, and if you're keeping an eye on the bills that are being submitted, Democrats are, I mean, the biggest submitters of bills right now are Democrats. They're submitting the most number of bills, a lot more by a significant amount than Republicans, which just shows you that when it comes to legislation that matters, Democrats, their heart and their minds and their souls are in the right place. They're thinking about Texans. And it also shows you that Republicans have also forgot how to work. They forgot how legislation works. They just absently forgot about it. And of course, as we're seeing here now, talking to Representative Howard, they're sort of hijacking other people's work. So because they forgot how to do their own work. So I think that's a couple of things that have kind of stood out to me this legislative session. So and also for those of you that do not know, I think how many states are currently exempting the tax for menstrual products?
Yeah,
How,
well, over half the states don't have the tax, and
yeah,
there are several states that do not have sales tax. We don't have an income tax in our state, and there's other states that don't have sales taxes. All the states are different. Um, that's been part of the challenge in our state, is that we do not have an income tax. So it disproportionately burdens those of lower incomes in our state because it is a sales tax and also the property taxes. But that's kind of a different subject than what you're asking me about. So there's
mhm,
over half. I think there's 5 states that don't have a sales tax, and there's 20 some odd states that have exempted it. So it's over half of the states that have put this in place. And the bottom line is that it's not going to be a significant amount of money in anybody's pocket to not pay the sales tax. But it does add up over time. And what we want to really do is raise awareness about the need for period products and how it's impacting people in our state. The schools will tell us that girls do not come to school for a couple of days every month because they do not have access to period products. They are losing those educational opportunities because they don't have access to period products. So this is it's discriminatory. This is a tax on a medical necessity. We don't put sales taxes on dandruff shampoo, for gosh sakes, on a lot of things, and yet we're taxing something that is absolutely required. You cannot go to work, you cannot go to school if you do not have protection. And as a nurse, I will tell you too, and the medical community will say this, we're talking about subjecting these girls to potential sepsis and infection,
mhm,
because if they do have to be somewhere and they don't have period products, they create things out of cloth, out of towels, out of toilet paper, out of whatever they can, and oftentimes leave it for long periods of time, which is absolutely unsanitary and can lead to infection. So we're also talking about a public health issue here as well.
absolutely. Absolutely. We're fortunate that my kids' PTA, we donate and we're able to sponsor,
That's
these
awesome.
types of products for girls in our schools,
Awesome.
Parent Vertical, which is great.
Yeah,
But
and I
that's
know
also,
AISD is currently making sure that they're having period products more readily available for
yeah,
students. So that's
absolutely.
awesome.
So important. You mentioned earlier, and these two bills go together. The House Bill 199, which is the diaper bill for children
Yeah.
and adults. And I personally know a lot of people that can really benefit from this with a wide range of ages. So do you think this bill has any kind of potential to also make it past committee?
I'm hopeful that it will. I mean, there's another Democrat who has filed similar legislation, Victoria Niave, and what she put in that I didn't was wipes, which I think is appropriate. What she didn't put in hers that I did was adult diapers. I think we need all of this. Um, Again, families that have young children, if they are working and they have their young ones in daycare, you supply your own diapers.
Yeah,
So if you don't have enough diapers, you can't take them to daycare and you can't go to work. And that is absolutely something that happens. It keeps people from being part of the workforce, from helping their own family get the funding that they need to support their own homes. And again, unfortunately, we see misuse and overuse of products to extend their life. So you have uh, diapers being used way beyond the period of time that they should be used, and
Mhm.
creating medical complications for these babies. And then I myself had experience with my husband when he was still alive and in rehabilitation and had to purchase the adult diapers. This for families that are on limited incomes, this is huge.
Yes.
And it is an absolute medical necessity. So once again, discriminating against, in this case, it's families really that we're talking
Absolutely.
about here. This is something that is absolutely required and a necessity. It should not be taxed. So yes, we have that legislation as well. I'm hoping to get some momentum for that because I think more and more families are understanding how what a burden this can be, whether they have little kids or they have aging parents or whatever, where you are having to use these products. And so yes, I'm hopeful about that.
Yeah, I'm looking forward to seeing the progress on that as well. Especially, I mean, I do have so many friends with special needs children that, are
Yes,
adults now and they need this. They
yes,
absolutely do. Everything is really expensive when you have a special needs child.
that's
So
right.
it's very helpful. So now let's talk about maternal health.
Okay.
That maternal health and the maternal health report finally came out, the one we were waiting for. It was a little bit disappointing because it only went through 2021. It didn't really cover much of 2022, which is when we saw Dobbs and some other things take place. So I think looking forward in the future, it doesn't look good, but it's going to get worse. You kind of
Yeah.
feel like it might get worse because there's a lot of things missing from it. So, what were the surprises that you found in the report when you read it?
I don't know that I had too many surprises per se, but validation of some of the things that we had been hearing about.
Yeah.
And let me just say, there is information up to 2021, but the report itself was only for 2019.
Oh,
Um, yeah, so what has happened is it's an extremely extensive review process that the Maternal Morbidity and Mortality Review Committee use. They have to go through hundreds, maybe thousands of pages of a chart, a medical chart, and determine what factors have been involved in the death or the near death experience of those who have been pregnant. And it takes, I don't even know how long, but it is a huge time commitment. Um, so we started with 2013 when this all began, and then have been trying to rapidly ramp forward. But as far as we are right now is 2019. So what the data we just got is from 2019. So we are before COVID even happened. So I'm extremely interested in seeing what we're going to see as we move forward and
mhm,
expedite. We're going to try to do some things to expedite that process so that we can get caught up to real time. But what was disturbing, I think, well, there's several things. The report was not released when it was statutorily required to be released.
mhm.
And the Commissioner of Health gave an excuse for that in terms of, well, the data wasn't complete, which happens all the time. Reports are released saying, this is preliminary data. We will update it as we get the rest of the information. Just held back on it totally, which immediately raised red flags that Governor Abbott did not want this information out there. And that continued for the next couple of months until after the election when we finally got the report. I think the things that were of concern, I'm assuming to him, that did come out of the report. One is that we're making some headway, but we still have a long way to go. Women are still dying of preventable deaths, and it is disproportionately impacting Black moms in particular, who are dying at 3 times the rate of others. For the first time, there was actually a metric that they used that looked at discriminatory practices that were implicated in some of these outcomes. So that was new information that was damning. The other thing that I think may have been something that he wouldn't have wanted out there based on his stance on guns is that one of the main causes of death of moms is by firearms, by homicide. And really tragic to think about the fact that women being pregnant in some situations where there is intimate partner violence um, leads to their deaths by firearm. Hugely problematic when you're not addressing gun violence in this state. So I'm assuming that that's part of what it was about. Nobody ever has really figured out exactly what was going on here. But the bottom line is that we did get some preliminary information about the interventions that are being done on postpartum hemorrhage, because one of the leading causes of deaths of moms in our state and anywhere in this country is hemorrhaging during the pregnancy, during the delivery, or even after going home. And we have an intervention that has been developed by the obstetrician and gynecologist that is called an AIM bundle. That's kind of a protocol of how to use best practices. And that has had a huge impact on reducing hemorrhage associated with pregnancies resulting in deaths, except for Black moms. Once again, we intervened and did something. It helped all other moms, especially Hispanic moms. Their rate plummeted. It was so successful. But for some reason, and one would suggest that those reasons have to do with implicit bias and systemic racism, Black moms are not getting the same benefits of these interventions. And we have got to address that. One of the things that we got rid of, not me, but the legislature did in 2017 was our Office of Minority Health. It was looking at disproportionality and disparities to try to impact. Why is this happening? Let's intervene and make sure we save these moms in this case, but also Black people were being disproportionately affected by all kinds of things, COVID. Right. So we're trying to reinstitute that office. I think Sean Theory has one of those bills to get that back in place. There is no reason we should not be looking at something that's so glaringly a factor in having healthy moms in this state.
Yeah, absolutely. So how do we compare to other states as far as maternal health? I know we compare ourselves to California all the time, but yet California's rate is several times lower than ours. You know, their rate is just, they do a much better job than we do.
Well, we're definitely in the top 10 worst states. It fluctuates depending on the data that we're looking at. We are certainly one of the worst in the developed world, but we're at the top in terms of the impacts on our moms here in Texas compared to the rest of the country.
Yeah, that's really sad. So this next report, if we can get it, it's going to be very telling because it's probably going to compile COVID.
Yes.
And life after, the no permit carry. Yeah. And what, and life after Dobbs. So we have a triple whammy report coming out.
You're right. You're right. And I'm hopeful that it will extend up, as I said, into real time. One of the things that's been an obstacle, just to get into the weeds for 1 second, it has been that a nurse has to go through all of these charts and redact anything that could identify not only the person, but also the facility, the location. It's a monumental task to do that takes so long. It's been cited as one of the reasons that they haven't been able to get this process done more quickly. The reason that happens is just because of some quirk in our Nurse Practice Act that is different than every other state in the country. So I'm working with the Texas Nurses Association and the Board of Nursing to come up with some language that we can use to address that so that we can exempt these nurses who are reviewing these charts from that part of the Nurse Practice Act that is preventing them from being able to move forward more quickly. Like I said, not get into too much of the weeds there, but I'm hopeful. And that was one of the recommendations out of the review committee that we do this. So we've taken that on in my office. And if we can make that happen, and expedite this process, then hopefully we can get back up to some real time by the time the next session comes around.
Yeah, and who would believe, like, that you even have to do that to begin with? You would think it'd just be like, you know, one of those standard common sense things that these nurses, don't have to fear for their jobs or their
Right,
lives or anything else.
right.
But we don't live in a common sense place anymore. So now
No, we
we're
don't.
having to write a lot of these things just to protect our nurses and our doctors and our hospitals.
Right.
It's just dumbfounding. It's just makes you crazy all the time.
Well,
So I know that there's this new omnibus bill for maternal mortality that Sean Theory is working on right now. So what do you know so far about anything that is part of this bill? Do you know anything that's in there that we can learn about?
I can't tell you exactly what's in her bill, unfortunately. I'm sorry, but I know that she's working on things like ensuring that we reimburse for doulas. There has been clear research that shows that that makes a huge difference in the outcomes of a lot of these moms. And we want to ensure that we are utilizing those doulas and that we are appropriately reimbursing so that we can have the doulas in place. And I'm trying to think of what else is in there. Can you remind me?
I don't know. I can't.
Okay,
I haven't read
there's a
that
lot
one
of
yet.
things.
I know she's still entering it. The last time I
Yeah,
talked to her, she was still working on it, but
and so she's also going to be looking at, I know, making sure that we are keeping track of these issues to ensure that we are identifying the impact on Black moms in particular, but really being able to get some real data that we're not collecting right now to be able to show how this is impacting women of color in particular. Also having um, very intentional efforts to get more people into the provider network who are also of color. There have been studies that have clearly demonstrated that you can get better health outcomes when people are treated by those who look like them, who are from their communities. Not to say that we all have to have everybody that looks exactly like us treating us, but the bottom line is if you are in a community of color and all you see are people that are white or predominantly men or whatever, it impacts your outcomes. And there has been research that's demonstrated this. So I know she's also working, as am I, on trying to get more diversity into the workforce, trying to find some novel ways to do that. So that's part of it as well.
yeah, I think those are all really great points. It is interesting. I've been reading the book The Janes. Have you seen the movie The Janes on
I
HBO?
haven't, I want to.
It's fabulous. And so I'm listening to the book. You can listen to it on a bunch of places like Audible for free and like Hoopla from like the library. So I've been listening to that. And even then it was like 1970, like the late 60s and the 70s. And
Right?
even the Janes, this group of women, they recognized the fact that having a Black doctor, provide abortions for Black women, the results were better.
Yes.
They recognize that right away. So this is nothing new, and we could do better for our Black sisters for sure.
Well, yeah. And the other part is, and this came out of a recommendation from the Mortality and Morbidity Review Committee, is that we need to make sure that we're including the Black community in the solutions that we're trying to come up with. Instead of telling them what is going to be helpful to them, making sure that they're part of the process of determining how do we get better outcomes, what do we need to put in place that will address the needs of the community. So that was a specific recommendation that came out of the review committee. I know that Sean Theory is working on that as well.
Yeah, well, that's exciting. I can't wait to learn more and see if anything goes anywhere with that omnibus bill. We're definitely going to be keeping an eye on it.
Good, thank you.
Yeah, so now that Republicans banned abortion in Texas, they got everything they wanted. What can we do to demand that they expand support for the mother, maternal health after the baby's born, the child? What can we do right now to
Well,
help
let me just say they didn't get everything they wanted. We just thought they did. They're coming back for more. And that's part of the challenge we have here is how we're going to be pushing back on that. They're looking at all kinds of things. Some have already been filed, some has just been threatened to be filed, but I'm sure will be. Bans on travel out of state. Uh, uh, Telling businesses what they can and cannot do for their employees in terms of the health care that they offer, in terms of assisting them to travel out of state for a legal healthcare procedure, telling them they cannot do that. And if they do, they'll lose some tax exempt status here or whatever, trying to threaten them financially if they do this. Trying to say that district attorneys in other counties can come into counties like Travis County, where there's been a real effort to say, we're not going to make this a priority.
Mm-hmm.
They're going to come in here and make it a priority for themselves, regardless of the fact that they are not our elected district attorney. These are elected positions. So they're telling the Travis County voters, the person you elected who's representing you, we're going to come in and take over despite who you chose in a democratic process. It's just unbelievable what they're looking at here. And they're also talking more about criminalization of the women. So, they're going to keep doing that, and we're going to have to keep pushing back. Now, in terms of what can we do this session about what's already happened, we are in the minority. We're not going to be able to repeal this. We know that. So what we're doing right now, what our focus is as chairperson of the Women's Health Caucus, what we are trying to lead the Democrats to do right now is to, number one, focus on access to healthcare. So with these things in place, what are we going to do to make sure that people, and women in particular, and those who can get pregnant, have the health care they need, so that, especially in light of the fact that we're going to have more pregnancies, put your money where your mouth is. Make sure that they have the health care they need to have healthy pregnancies, healthy deliveries, healthy postpartum periods, healthy babies. So we're going to be focused on access. The other thing is a two-pronged approach: access, damage mitigation. What can we do to lessen some of the impact of the legislation that was passed? So, of course, one of the obvious things that people will think about is rape and incest exception. So I have legislation for that. What I've been doing, and my office has been doing, is working with those who work in this space. So the Texas Association Against Sexual Assault, the Child Advocacy Centers, those that work with children and adults who have been sexually assaulted. And also with the Sexual Assault Survivors Task Force that we got put in place 2 sessions back, that has been working diligently on how do we get a process in place for those who have been assaulted that is survivor-centered and trauma-informed and gives them trust and confidence in the system. Well, number one that comes out of all of that is very few people report their assaults. And the main reason for that is because most people are assaulted by somebody they know, somebody that lives in their home, somebody that's a family member, and they do not want to report. So what we're doing with our legislation to exempt rape and incest is to have language that protects the person from having to report to law enforcement in order to obtain the abortion. I don't know if we're going to be able to make that happen, but we do not want to re-traumatize these people.
Yeah.
They have already been through a horrific situation. They don't want to report for whatever their reasons are. We want them to get the care that they need despite that. And we don't want them to be forced to have to make a law enforcement report in order to access abortion health care. So that probably is going to be a bit of a challenge, but that's that legislation. And then the other piece that I have that's about damage mitigation is to try to clarify the language, the ambiguous language in the bill that has resulted in physicians being unable, unwilling, concerned about intervening in medical care when women present with medical complications when they're pregnant, because they are fearing for losing their license, losing their livelihood, and actually going to jail. We know that there have been multiple instances of those who have been pregnant, who wanted their pregnancies, who ended up having complications, an ectopic pregnancy, or some other situation that develops. They come in to see their physician. They're not yet at the point of being on the brink of dying, which is what the bill basically requires. The doctors are sending them home to get worse so that they can then intervene. The doctors actually are saying, using this language when they talk to me about it, they say, we are having to wait for women to start dying. That is obscene. And, we can say, well, the doctor should be taking care of them anyway. And some of them are. But we have to realize what position we have put them in, threatening their very licensure and
Absolutely.
maybe putting them in jail for practicing medicine. So we're working with the obstetrician and gynecologists, with the medical association, trying to get clarifying language that's not so prescriptive that we still create problems for them, but that allows them to use their medical training and judgment. For gosh sakes, we go to doctors because they have been trained and educated to assess our situations and use their judgment. It's not like you look in a book and, oh, this is what you do for everybody. No.
Yeah.
They need judgment. So anyway, so those are the two main things that I'll be working on in terms of the damage mitigation.
Yeah, that's, I mean, you make some really great points there. Last night, we had a webinar on like this, Roe 50 years later and what we can legally do now. And a couple of people brought up some really good points, especially from a physician's point of view. I mean, we had people who were trained on how to give abortions, and they did this all day long, and they practiced it, and they had a good bedside manner. They became professionals. They took care of the women. They really accounted for loving care for these women. And now we have women who are miscarrying, and they're going into the emergency room. So then they're now being dealt with by emergency room doctors. And we know that this is not always the best type of doctor for a woman having a miscarriage,
Right.
who might need someone that has more experience or
Yeah.
has experience in this type of situation or trauma that a woman is going through. And then we take them, and let's say that they do an internship in Texas. Well, if they come and they do internship in Texas, they might not be able to apply for jobs in other states because they do not have the experience
Yeah.
of doing this type of care. And
Yeah.
this hurts our doctors from getting a certain level of education. I mean, there's a big picture here that I feel like Republicans aren't, taking into account, and how it
Oh,
affects
absolutely.
many
And
things.
we I'm waiting to get some data. I know that some physicians are looking at this, but clearly we already have situations here with our medical schools in Texas where they are having to rotate out of state to get the kind of training they need in pregnancy terminations, which obviously are used for a variety of things that could come up. And we've already talked about this in terms of medical complications in wanted pregnancies. That happens a lot on ectopic pregnancies, hemorrhaging that might occur, all kinds of things that can happen. And physicians are not going to be trained in Texas to do these procedures. So that's going to result in a lot of things. Number one, have potentially people that are not trained in our state. We already have a shortage of physicians and other healthcare providers. This could keep people from practicing in Texas, but those that are here, that were trained here, may not have the skills that they need to intervene in these very difficult situations that present regularly. Where are these moms going to go if we do not have physicians here to do that? It is a serious problem. And, we've already seen that there are some students who are choosing not to come to Texas
Yeah.
because of this. We have already seen that there's some faculty that are leaving because of this. The ripple effects are huge and are going to have implications for obviously not only those that are seeking abortions, but those that want pregnancies and have complications. It's unbelievable to me what has been opened up here and what many are just not aware of. The unintended, I hope it's unintended, but
Hmm.
the unintended consequences of this.
Yeah, I got together with some girlfriends a couple nights ago, and the point of conversation we all had at the table was how many do you still have your OBGYN? Do you still have your OBGYN? Because every single one of us goes to a different practice, but our practices are losing their doctors and they're
That's right.
moving to Colorado. They're moving
Yep.
to California. They're moving to
Yep.
New Mexico. They're leaving.
Yep.
And it was kind of shocking, especially some of our doctors that specialize in fertility medicine. I mean, that can no longer happen here.
Well, we're very concerned about what's going to happen with IVF and fertility
Hmm.
treatments. And, there are those that are threatening to have, well, they're already saying that they want to define this as life beginning at conception and the implications that might have for stored embryos. Um, it's just mind boggling what's being talked about there, whether or not people would be forced to either carry those embryos that they may not have been planning to use all of them, or actually let somebody adopt their embryos. I mean, seriously, it's just unbelievable. It's really
Yeah.
unbelievable. But not be able to dispose of these frozen embryos, not be able to use them for science as we currently can do. I have a son and daughter-in-law who have 5 frozen embryos. They've had their 2 daughters, and they weren't planning to have any more. They've stored theirs in Nevada, and
That's smart.
it's just this is such a personal decision for people to be making, and to
Yeah.
have the legislature step in such a way. Well, I won't.
Yeah.
I mean, clearly, we're talking about one way of addressing when life begins, and you know
Hmm.
that's the existential question here, of course. And one of the beauties of Roe that made it work so well, whether people agreed with everything about Roe or not, is it found that balance between protecting the life and the rights of the woman with the life and the rights of a viable fetus. And so the first trimester, you could have an abortion without having restrictions and regulations. The second trimester, there might be some regulations. The third trimester, they erred on the side of saying this is, unless the woman's dying, you do not have an abortion then. Whether you agree with that or not, what it did was, and I heard one of the lawyers that argued Dobbs say this, and it resonated with me. It was a biological and ideological demarcation. It was a way to balance the rights of 2 separate entities
Hmm.
in a way that gave us some room to make some decisions about our own bodies. And
Yeah.
that's gone.
Yeah.
That's gone.
Absolutely. It's shocking that it's gone. So we're going to change the subject a little bit
Okay.
here, and then we're gonna maybe go back in just a second. But all of these things are all sort of related to each other.
Okay.
Um, one shocking article that came out recently, and I think it was in the Texas Tribune or it might be in the Houston Chronicle, was about childcare in Texas and childcare deserts. So when we think of, Texas, it's like we're not doing so good. We do not have we have deserts of hospitals, we have deserts of childcare, we have deserts of affordable childcare. Um, what can we do during this legislative session to support families that need this kind of help? I mean, certainly Republicans, they're campaigning that, they're so pro-life and whatever, they want everybody to give birth, but now it's time for them to step up to the plate and show us what they got. How are
Yeah,
they going to start supporting families, especially in those areas with huge childcare deserts?
absolutely. Um, yeah, I mean, I was in a meeting today at the Capitol where some folks that work in this area were talking to us about what they wanted to see in legislation to help us expand that. During COVID, of course, it became crystal clear that childcare is an economic development issue and that people cannot go to work if they do not have childcare.
Hmm.
That we had some COVID relief dollars that helped get some of these childcare facilities through the hump of the pandemic, but many of them just had to shutter and they closed. The pay is awful. We don't pay people enough to provide care to one of our most precious commodities, our children,
Yeah.
developing children. So what's being proposed now and going to be looked at this session is putting some funding in particular into creating more opportunities to open these facilities and pay staff more, doing it through the Texas Workforce Commission, which already has child care programs and is trying to work on having quality child care, because we don't want just child care. We
Yeah.
want quality child care. So part of what we want to do with the surplus, and there is some bipartisan support for this, is to look at how do we expand our child care opportunities. And that includes a lot about dealing with workforce, which is another huge issue, is we have workforce problems around just about every industry right now. But I also want to say that in addition to the child care, just as you were prefacing this, in terms of making sure that we're helping take care of all these moms once they have their babies, we know that over half of our deliveries are already Medicaid. And with the forced deliveries that are going to happen now, we're going to have those of limited means are going to be the ones that can't travel out of state and get childcare and get transportation and overnight care and all the things you have to do to be able to travel, hundreds and thousands of miles away to get a safe abortion. So it's going to be people of limited means. So it's more than likely going to be people who are going to have Medicaid births.
Hmm.
We're going to increase that population, and we have got to make sure that we have the programs in place to give them the care they need. And that's not just the care they need for their pregnancies. We need to be making sure women have access to preconception care so that they're healthy, they have their blood pressure under control when they get pregnant so that they don't end up having eclampsia. We've got to take care of them during pregnancy, postpartum, take care of their babies, make sure that they have what they need to be healthy families. So we're talking a lot about, okay, you guys say you're pro-life. Let's make sure you show it here and what you're going to
Yeah.
be doing to support not only who we already have out there that's not getting what they need, but all the new moms that are going to be there as a result of this legislation. So we're going to be approaching it from a wide variety of angles here, but really trying to get them to connect to the fact that if you're going to be pro-life, that means pro-life for those that are having these babies.
Yeah, absolutely. I always say, take it all the way. Show me what you got. Just
Yeah,
wait time to show up. You
yeah,
know, they've been preaching this for a long time, and now that they got
yes,
it, time to show up. So
yeah.
do you think Texas will have a chance at passing and accepting the Medicaid expansion now? This
You
is our
know, you would think, well, we're so
money.
far past that, but you would think, um, last session, the Maternal Morbidity and Mortality Committee had recommended that we expand postpartum coverage from the current 2 months to 12 months, because the vast majority of pregnancy-related deaths occur within the year of delivery. And also the near deaths and the chronic conditions that develop happen during that time. So the House, in a bipartisan fashion, with the leadership of Speaker Phelan, I will say, he took this on as something that he was supporting. We did pass a bill that Tony Rose had to expand Medicaid coverage from 2 months to a full year. The Senate decided they didn't want to go that far and would only pass 6 months postpartum coverage. So that's what we ended up passing. Long story short here, that because of some different regulations going on with the federal government, we could have easily gotten the waiver to get approval to go to 12 months postpartum. But because we only went to 6 months, we had to go through extra hoops because the government was trying to incentivize going to 12 months. So they did not approve our 6-month extension. So right now we're back at the legislature with 2 months postpartum care again, and looking once again at can we expand that to 12 months postpartum. I will be shocked and disgusted if we can't get that through this time after what's just happened. We know that this will make a huge difference in saving the lives of Texas moms. And for the 100 or so, we're not sure what the exact number is, 100 or more women that die. There are probably 50 times that women who end up having chronic conditions that could eventually kill them, but that they have to live with as a result of these pregnancies, and we have to get them the treatment they need. Now, just one more thing I'll say is, Medicaid expansion would make this moot, because not only would they get the postpartum coverage, but they would get the prenatal coverage, the preconception coverage. Medicaid, you have to be pregnant to get Medicaid. That means you may not get in until after you've gotten through the first critical developmental months of the pregnancy. Some don't come in till it's delivery time. And what does that mean for outcomes? And once you've gotten past having the babies, you want to be able to space any future pregnancies, because that's clearly associated with maternal health and infant health. Why can we not just expand Medicaid and have these women covered through their entire perinatal period so that we can have healthy moms and healthy babies? It's just
Amen.
mind-boggling.
Amen. I completely hear you there. So one thing I learned from Ruth Bader Ginsburg is that when she thought about passing rules and laws, she included men in them, because she realized that by including men in some of these benefits,
right,
and making them be part of the solution, the chances of them passing are a lot higher. So will we see paid family leave that benefits both men and women? And could we possibly pass this in Texas?
Yeah, well, again, the Speaker of the House has now set up paid family leave in the House through our budgets in the House.
Mm-hmm.
That's a huge step. In terms of what we're doing as a statewide effort, though, I know that Representative Penny Morales-Shaw has some legislation that she's working on that will create parental leave, including paternity leave. So I'm not sure what her final bill is going to look like. I know she's working on it now, trying to figure out a funding source to make this happen. But that's a bill that she's working on. Absolutely.
Okay, so I'm going to put this one in here. I don't know if you know this, Donna, is I have a special needs son. He is,
Okay.
He's 17 years old. He has a rare auditory processing disorder, but this has resulted in some what is perceived as cognitive delays due to a poor working memory. So it's really important for me to just find a future for him in Texas. So because I have this special need son, and I'm looking and I'm doing all the Medicaid stuff right now, and I'm filling in all the forms, and I'm getting set up in Social Security. And let me tell you, it's a full-time job. It's taking a lot out of my day to sit here and figure out, like, okay, what do I need to do? How many forms do I need to fill out? So, what can we do about that list on the Medicaid waiver that we currently have in Texas? I mean, we have special needs Texans who've been on the waiting list for care and for residential facilities and for the Medicaid waiver for over 10 years. I mean, it's
longer. Yeah.
Longer. Yeah, it's like they all vary, but it's long. And it's when I started out, it was like 9 years, but it's double that easily now. What can we do?
Yeah, well, there are several things that are moving right now. Again, we'll see how far they go. It was encouraging to hear the lieutenant governor, actually, when he laid out his plans for what he wanted to see happen with the budget surplus. He wants to see additional beds being built. Now, he was focused on, I think he was focused more on residential treatment beds. But that being said, at least it's a start to talk about it. We know that we need a huge number of step down facilities, of facilities that are halfway and quarter way houses and whatever you want to call them. We need a wide variety of options because right now we don't have any place to send a whole lot of our Texans who need these services. The other part of it is workforce and the fact that we do not have the providers and caregivers that we need. And a lot of that has to do with very minimal reimbursement rates. We have one of the pieces of legislation that I'm working on, and I've been working on with some of the advocacy groups, has to do with the wages that we're paying for home-based attendants. And right now the base wage for that from the state is $8.11 an hour to be in a home to take care of some of the most vulnerable Texans. And I had somebody in my home helping me when my husband was still alive to take care of him. I had the resources to be able to help make that happen and hire somebody. If you don't, I mean, even then it's hard to find somebody. But when you are talking about $8.11 an hour, when somebody can go down the street to Buc-ee's or Starbucks or whatever, you cannot get people for these critical jobs that are so needed and demand so much of them too. So we're working on trying to figure out ways to increase that to $15 an hour. And that has a couple of $1 billion price tag on it to do it. But I don't see we have any other choice. We have an aging population. We have this huge wait list, which, oh, by the way, the state doesn't call it a wait list. They call it an interest list because it doesn't sound as offensive as a wait list.
Well, their interest list is offensive.
Yes, agreed. So we've got to address this with a multifaceted approach that is creating the beds that we need, the facilities that we need, the outpatient facilities that we need, the caregivers that we need, looking at the reimbursement rates. It's really a huge effort, but I think there's a lot more bipartisan awareness of it than there ever has been before for whatever reason. Great work on the part of the advocates to make people aware of this, but I'm hopeful that with this surplus, this will be one of the things that will rise to the top this time.
Yeah, I hope so too. Along with that, I mean, you just kind of mentioned like we need more beds and more things. I mean, CPS, Child Protective Services, has been a humongous mess. And it has been a humongous mess since I moved to Austin 20 years ago. I mean, it just doesn't seem to be getting any better. So is there anything coming up here as far as change in which we can help, protect the Texas most vulnerable children that are in this system? What can we do?
Yeah. Again, a lot of things we need to do. And I keep talking about workforce because unfortunately that is a huge part of this. The state is bleeding staff. That's just the way it is. We've got the highest turnover we've probably ever had overall in our state. I think it's 22%. In some agencies, it's 70 something percent. And clearly those that are dealing with in the foster care system, it's such a difficult job. And we do have high turnover there. So we're looking at overall increasing state employee salaries across the board, but certainly wanting to look at these especially difficult areas like the criminal justice system, the juvenile justice system, and CPS. Those are areas that are extremely hard to keep people in, and we've got to pay to make sure that we have the people there to give good care. Also looking at how should we be doing a better job of reimbursing for kinship care when we, instead of removing kids from the home, if there's a family member who will take them in and provide for them, why would we not give them the same kind of financial stipend to take care of those kids as we give to somebody who is not a relative? The fact is that these folks are also taking care of these kids and providing them a loving home so that they do not have to go into the system. And we need to do everything we can to create a more welcoming environment and opportunity to have kids in homes where they're not being removed from their families, not being removed from their communities. What's happening a lot of times, unfortunately, is they're being moved to other communities far away from anybody that they know or love. We don't have
Mhm.
the residential treatment programs that we need, and we have some severely, uh, what's the right word to use? Severe behavioral health issues among some young people. And in fact, from what's been reported by those working in this area is that some of these kids are coming into the foster care system because their parents, quite frankly, cannot manage them anymore, and there's no resources for them in the community. And then the foster care system totally fails as well. It just exacerbates the situation. So we've got to be looking at facilities, at reimbursement rates, at kinship care and how we can promote that, and at building more community-based programs that allow kids to stay in the home with their families. A lot of the abuse and neglect reports have to do more with, I guess you would say, the neglect end because of the parents having substance use disorders. Rather than taking them out of their home, getting the family into some treatment programs where the kids can still stay with their families while they're working on treatment programs under a certain amount of supervision, but still putting them into the dysfunctional, overburdened CPS system where kids are getting hurt, are getting killed, are getting assaulted. We don't want to do that if we don't have to.
Yeah, absolutely. What about adoption? I mean, is there anything going on as far as like Republicans passing something to make adoption easier?
Yeah, and I'm sorry I don't know the details about it, but yes, there are some legislators that are looking at how to streamline that system that makes it easier for folks to be able to adopt. So indeed, that is something that's being looked at. I just don't have the details about it.
Yeah. Okay. So I have one more question.
Right.
And this will probably be the last one. I don't know if anybody in the audience has any questions. I might be able to take one. But one, just an observation I've noticed. I've been reading a lot of bills, and I'm noticing that a lot of bills around like women's health issues are putting in some talk that on LGBTQ issues, and we're
Mm,
seeing that a lot, where we're seeing them nest in a bill, like basically their trans hate and some other stuff and all the things, terrible things that are trying to do to our trans communities here in Texas, to attack them. And a lot of people aren't paying attention because a lot of times this wording is so subtle and it's nested in a bill. So what I'm seeing is that Republicans got used to basically fundraising off of the pro-life issues, and now they're fundraising off of the LGBTQ issues. So they just picked a new enemy and they're just loading up these bills. So what can we do? I mean, what do we need to pay attention to right now as far as the bills and things going on the ledge? What can we do to pay? Where do we need to pay attention, and how best can we help lobby right now to make sure that we support our LGBTQ community as well as our reproductive justice, community?
yeah. To me, the greatest example of how this worked with the community weighing in was with the 2017 bathroom bill, for anybody that was a part of any of that. The fact is that the communities, all kinds of communities, rallied against that as discriminatory, as hurtful to our children and families, as something that would, and from the business community, as something that would affect their recruitment and retention if families felt like they were going to be discriminated against. And we had people at the Capitol uh, from all walks of life there to be opposed to that discriminatory practice, from the medical community, the faith community, the law enforcement community, the business community, the tech community, everybody out in force, the advocates to
I
defeat
remember.
this. Now, of course, we had Speaker Strauss then, and he was instrumental in being a
Mhm.
wall against that progressing. But again, I think it gave us a good example of how we can all come together. And I will have to say that last session, part of the problem with COVID is people didn't show up. And I totally understand why. We couldn't.
Yeah.
Some of the people that are for this kind of legislation, though, did show up because a lot of them don't believe in the science and they showed up. But we did not have people at the Capitol saying, don't do this stuff. This is hurtful. This is discriminatory. So I don't know how it's going to look this session exactly, but please show up at the Capitol. We need people out in force to come to testify, to talk to representatives, to rally when there's rallies going on, to do whatever it is that can show the swelling of support across a variety of communities in our state that say this is not the Texas way. This is not the way we're going to do business. And we really need the business community to step up again. A lot of times they talk about this stuff, but they still put their money behind the campaigns of those who are in power.
Mhm.
And that's just defeating the whole purpose there.
Yeah,
So,
absolutely.
yeah.
Absolutely. So, does anybody have a quick question who's in the audience today? If you raise your hand, I will call on you. I know I asked a lot of really great questions. So, I mean, I'm sure not many of you probably. Okay, Cheryl, go ahead.
Yeah, I was just curious if you had been reaching out to corporations because money talks.
Yeah.
And pulling money talks even more. And I was just wondering what kind of response you've been getting because they're the target of, I'm tracking 24 bills, anti-choice bills, and they're going after corporations from multiple points.
Absolutely. The so-called pro-business party is absolutely pro-business, limited government, limited regulation. Oh my gosh, the exact opposite. And yes, we are talking to corporations, and we've actually had some visit my office. I know other offices that have said they're still talking behind the scenes a lot of times, but they have said, what are we going to do here? This is going to cost us a lot of money because we're going to have to be out there, especially those that are corporations that have multiple state presence in multiple states. They've got to navigate all the legal quilt work, patchwork of what's legal in this state, what's not legal in this state. And they are scared and they are concerned about their bottom line. So yes, we are talking to them. It's still, we have to make, I don't know what they're going to ultimately do. You know, we had, what was it called? I think Texas Connects, was that the name of it? There was a group that was organized around businesses in the bathroom bill legislation that
I don't remember.
tried to help them have a critical mass so that they could have some safety in numbers, I guess, and make it real business focused. Maybe we need to get something like that going again, but you know, it's just horrific. And going after schools and libraries and teachers and you know, this whole thing about drag queens and creating sexually oriented businesses, you understand what that would involve, the way they've got this set up right now. Anybody who dresses in apparel of the opposite sex. So what does that mean for Shakespeare performances? What does that mean for the Nutcracker Suite with Mother Ginger coming out with, you know, all the guys that dress in that? What's it going to mean for all kinds of plays, all kinds of performances? What's it going to mean for the UT Longhorn mascot who could be a male or a female inside that costume? You know, this is ridiculous. It's ridiculous. They're making an issue where none exists, for one thing. So I don't know where this is going to go, but we're going to need rational, reasonable people to come together and say, enough is enough.
Yeah.
Stop this.
Absolutely. And just to let everyone know, starting this week, we're going to have 2 days where we're going to have some campaigns for 2 days called Fill the Lines, where we want you to call the Capitol. We want you to call your state senator. We want you to call your state representative, and we want you to tell them about the bills that are most important to you. This week, we're focused on Donna Howard's bills. So we want you to call other senators and tell them, please work with Donna Howard. Let's work on these bills, because it's super important that we all let the people who represent us know about that these bills exist, that they need to go to committee, and that they're going to benefit all Texans. So we're going to be putting out that information on Thursday and Friday with the emphasis on fill the lines. We're going
Thank you.
to start filling the lines at the Capitol and showing people that we're going to show up. We might not be able to show up in person, all of us right now, but we can show up by filling the phone lines.
Awesome.
So yeah,
Thank
we're gonna be doing that, and that's one way that we could support, since we're a group. We're not all in Austin, but we're across the state, and this is one way we could do one thing we could do to show up and support you.
It's wonderful. Thank you so much for coming up with that. That's a great idea.
Yeah, well, thank you so much for your time. And you took so much time with us today, so I really appreciate it. And I'm so
Sure.
glad that you're my representative, and I'm so glad I found a really cool sign in my garage. And
Me too. Thank y'all so much for all you do. It really means a lot to all of us out on the front lines here, knowing that you're there with having our backs and helping us stand up, continue to stand up. So we couldn't do it without you. Thank you so much.
yeah, we're the feisty moms behind
You are.
So we really appreciate you all. So I'm gonna let you all go. You all have a wonderful evening, and thank you, Representative Howard, and we will see you soon. Thank you so much.
Thank y'all. Bye-bye.
Bye-bye.